Maternal Newborn Intrauterine Growth Restriction Quiz with Rationales. Question 1. A nurse is performing a vaginal exam on a client who is in active labor. The nurse notes the umbilical cord protruding through the cervix. Which of the following actions should the nurse take? Option A. Administer oxytocin to the client via intravenous infusion. Option B. Apply oxygen at 2L/min via nasal cannula. Option C. Prepare for insertion of an intrauterine pressure catheter. Option D. Assist the client into the knee-chest position. The correct answer is option D. Assist the client into the knee-chest position. Assist the client into the knee-chest position. Question 2. Which of the following is true about the 3 layers juries and parents are concerned about the long term of involuntary smooth muscles of the uterus? Option A. Designed to provide expansion of the growing fetus. Option B. Meant to inhibit the contraction of the uterus. Option C. These injuries require immediate surgery prior to the onset of labor. Option D. Your child will have permanent paralysis. The correct answer is option A. Designed to provide expansion of the growing fetus. The correct statement about the 3 layers juries and parents are concerned about the long term of involuntary smooth muscles of the uterus is that they are designed to. Question 3. Which statement by the patient helps the nurse know? Option A. Follicle stimulating hormone. She understands the teaching about condom use. Option B. Gonadotropin releasing hormone. Option C. A condom can be worn for 2 sexual encounters. Option D. Progesterone as long as it does not break. The correct answer is option A. Follicle stimulating hormone. She understands the teaching about condom use. The statement condoms come in different sizes. It is important I get the right size to ensure proper protection indicates that the patient understands the teaching about. Question 4. A patient is about to undergo an amniocentesis. Should on her postpartum clients. Which client has a which procedures should the nurse perform? Select high risk for postpartum hemorrhage. Select all that apply. Option A. Have the patient give verbal consent for the. Option B. Client who delivered vaginally at 40 weeks procedure. Option C. Client who delivered by cesarean delivery because. Option D. Assess for bleeding disorders. The correct answer is option A. Have the patient give verbal consent for the. In this scenario, option A is the correct answer as having the patient give verbal consent for the procedure is a crucial step before conducting an amniocentesis. Question 5. A nurse is assessing a preterm newborn who is at 32 weeks of gestation. Which of the following findings should the nurse expect? Option A. Minimal arm recoil. Option B. Popliteal angle of less than 90. Option C. Creases over the entire sole. Option D. Sparse lanugo. The correct answer is option B. Popliteal angle of less than 90. A preterm newborn at 32 weeks of gestation is usually characterized by hip flexion posturing and a popliteal angle of less than 90 degrees. Question 6. A nurse is admitting a client who is at 33 weeks of gestation and has preeclampsia with severe features. Which of the following actions should the nurse take? Option A. Restrict protein intake to less than 40 g/day. Option B. Initiate seizure precautions for the client. Option C. Initiate an infusion of 0.9% sodium chloride at 150 ml/hr. Option D. Encourage the client to ambulate twice per day. The correct answer is option B. Initiate seizure precautions for the client. In a client with preeclampsia with severe features at 33 weeks of gestation, initiating seizure precautions is a priority nursing action. Question 7. A nurse is assessing a client who is at 31 weeks of gestation. Which of the following findings show potential prenatal complication? Option A. Periodic tingling of fingers. Option B. Absence of clonus. Option C. Leg cramps. Option D. Blurred vision. The correct answer is option D. Blurred vision. Blurred vision is a potential prenatal complication during the 3rd trimester of pregnancy and can be a sign of conditions such as preeclampsia or gestational diabetes. Question 8. Visions before finding one that works. Option A. Once you take the prescribed medication you plan on teaching this client, will be cured of the infection. Option B. Breastfeeding. Option C. Even though you don't experience symptoms. Option D. Postpartum depression you can still spread the infection. The correct answer is option C. Even though you don't experience symptoms. Is the most appropriate statement to make to the client because it addresses the reality of sexually transmitted infections, STIs. Question 9. Placental circulation is dependent on maternal circulations for preventing sudden infant death syndrome? Lashon. In which maternal circumstances is placental? Select all that apply. Circulation impeded? Select all that apply. Option A, position newborns in the prone position to. Option B, hypotension. Option C, preeclampsia. Option D, avoid soft bedding or pillows in the newborns. The correct answer is option B, hypotension. Hypotension in the mother can result in decreased blood flow to the placenta, affecting placental circulation and oxygen delivery to the fetus, increasing the risk. Question 10. What should in the FHR that is abrupt and appears to be? Does the nurse inform this group that they are at in the shape of AW? What is the most likely cause highest risk for? Of this? Option A, sexually transmitted diseases. Option B, compression of the fetal head. Option C, uterine cancer. Option D, compression of the umbilical cord. The correct answer is option D, compression of the umbilical cord. An abnormality in the FHR that is abrupt and appears to be in the shape of a W is often indicative of variable decelerations. Question 11. A nurse is caring for a client who is experiencing sore nipples from breastfeeding. Which of the following actions should the nurse take? Option A, place a snug dressing on the client's nipple when not breastfeeding. Option B, ensure the newborn's mouth is wide open before latching to the breast. Option C, encourage the client to limit the newborn's feeding to 10 minutes on each breast. Option D, instruct the client to begin the feeding with the nipple that is most tender. The correct answer is option B, ensure the newborn's mouth is wide open before latching to the breast. Ensuring the newborn's mouth is wide open before latching to the breast is the correct action to take when caring for a client experiencing sore nipples from breastfeeding. Question 12. A nurse is reviewing the laboratory results for a client who is at 29 weeks. The provider? Option A, WBC count. Option B, 11,000/mm superscript 3 hemoglobin. Option C, 11,2G/DL. Option D, HCT 34% platelets 140,000/mm superscript 3. The correct answer is option B, 11,000/mm superscript 3 hemoglobin. 11,000/mm superscript 3 hemoglobin. At 29 weeks of gestation, hemoglobin levels are crucial to monitor for anemia in pregnant women. Question 13. A nurse is teaching the parents of a newborn how to care for their child's uncircumcised penis. Which of the following instructions should the nurse include? Option A, retract the foreskin until you feel resistance. Option B, use a cotton swab to clean under the foreskin. Option C, apply petroleum jelly to the foreskin. Option D, wash the penis once per day with soup and water. The correct answer is option D, wash the penis once per day with soup and water. Because washing the penis once per day with soap and water is the appropriate way to care for an uncircumcised penis. Question 14. Which health concern is most likely to be an issue for the older mother? Option A, nutrition and diet planning. Option B, exercise and fitness. Option C, having enough rest and sleep. Option D, effective contraceptive methods. The correct answer is option A, nutrition and diet planning. As women age, their nutritional needs may change, and they may require more specific nutrients to support their health. Question 15. Which of the following is an example of healthy grieving? Option A. The mother exhibits an absence of crying or expression of feelings. Option B. The parents do not mention the baby in conversation with family members. Option C. The mother asks that the baby be taken away from the delivery area quickly. Option D. While holding the baby, the mother says to her husband, "He has your eyes and nose." The correct answer is option D. While holding the baby, the mother says to her husband, "He has your eyes and nose." While holding the baby, the mother saying to her husband, "He has your eyes and nose," is an example of healthy grieving. Question 16. The nurse is caring for a postpartum client who is: Option A, maternal hyperglycemia 1 day post-cesarean birth. What assessment data? Option B, FHR, early decelerations would indicate infection? Select all that apply. Option C, FHR, late decelerations. Option D, increased pulse. The correct answer is option A, maternal hyperglycemia 1 day post-cesarean birth. What assessment data? In this scenario, option A is the correct answer. Question 17. Which of the following is an abnormal finding upon? Option A. To monitor hydration status physical examination of an infant. Option B. To reduce the risk of bladder injury. Option C. Anterior fontanelle that has a diamond-shaped open. Option D. To prevent the patient from urinating during space surgery. The correct answer is option D. To prevent the patient from urinating during space surgery. The abnormal finding listed in option D, to prevent the patient from urinating during space surgery, stands out from the rest of the options provided. Question 18. A 29-year-old low-risk primiparous patient has just placental abruption? Option A, mild grade 1. Option B, moderate grade 2. Option C, marked grade 3. Option D, severe grade 4. The correct answer is option B, moderate grade 2. Placental abruption is classified based on the severity of symptoms and extent of separation of the placenta from the uterine wall. Question 19. A pregnant patient who abuses cocaine admits to exchanging sex for her drug habit. This behavior puts her at a greater risk for option A, postmature birth. Option B, sexually transmitted diseases. Option C, hypotension and vasodilation. Option D, depression of the central nervous system. The correct answer is option B, sexually transmitted diseases. Sexually transmitted diseases. Exchanging sex for drugs increases the risk of acquiring STDs due to engaging in unprotected sex with multiple partners. Question 20. A patient who is older than 35 years may have difficulty achieving pregnancy because option A, pre-pregnancy medical attention is lacking. Option B, personal risk behaviors influence fertility. Option C, contraceptives have been used for an extended period of time. Option D, the ovaries may be affected by the normal aging process. The correct answer is option D, the ovaries may be affected by the normal aging process. As women age, their ovarian reserve decreases and the quality of their eggs declines, making it more difficult to conceive. Question 21. A patient at 24 weeks of gestation reports that she has a glass of wine with dinner every evening. Which rationale should the nurse provide this patient regarding the necessity to eliminate alcohol intake? NRIGB.CMUSNTO. Option A. The fetus is placed at risk for altered brain growth. Option B. The fetus is at risk for severe nervous system injury. Option C. The patient will be at risk for abusing other substances as well. Option D. A daily consumption of alcohol indicates a risk for alcoholism. The correct answer is option A. The fetus is placed at risk for altered brain growth. The correct rationale that the nurse should provide to the patient regarding the necessity to eliminate alcohol intake during pregnancy is that the fetus is placed at risk for. Question 22. Which client would be at greatest risk for developing? Option A, thick breast cancer. Option B, wet/slippery with egg white consistency. Option C, client who had her first baby at the age of 24. Option D, client who did not breastfeed. The correct answer is option D, client who did not breastfeed. Not breastfeeding has been identified as a risk factor for developing breast cancer. Question 23. As the infant nursery nurse, you are assisting with A. Option A, assess the fetal station delivery. After the initial assessment of the baby. Option B, assess for rupture of the fetal membranes. What is the next best action? Option C, determine dilation of the cervix. Option D, give the infant a bath. The correct answer is option C, determine dilation of the cervix. For correct answer, C, determine dilation of the cervix 1. Question 24. The nurse is discussing danger signs during pregsion procedure. Which statement is appropriate for Nancy with a pregnant woman in her first trimester? The nurse to make. Which of the following signs and symptoms would? Option A. A catheter is inserted through the cervix into the be appropriate at this time. Select all that apply. Option B, severe headache and visual changes. Option C, persistent vomiting and nausea. Option D, sperm or ovarian tissue will be frozen for. The correct answer is option B, severe headache and visual changes. Severe headache and visual changes are potential danger signs during the first trimester of pregnancy, indicating conditions like preeclampsia. Question 25. A nurse is caring for a client who is in labor and has a diagnosis of group B Streptococcus B hemolytic infection. Which of the following medications should the nurse plan to administer? Option A, ampicillin. Option B, azithromycin. Option C, ceftriaxone 1. Option D, acyclovir. The correct answer is option A, ampicillin. Ampicillin. Group B Streptococcus, GBS, infection during labor is typically treated with intravenous antibiotics like ampicillin to prevent transmission to the newborn.